Thank you very much, Mr Gray. It's a pleasure to serve under your chairship and a pleasure to be in this debate, although I hope in future years there won't be a need for this debate because we'll have solved these issues, and it is absolutely equal for any woman to go into any maternity service and expect the same amount of care and the same equal outcomes as any other woman. That's why I was so keen to be in this debate today, and I congratulate the Honourable Member for Streatham for bringing this debate again and for keeping on pursuing this issue. And I look forward to hearing the response from the Minister later because it needs to be a priority issue. In Wandsworth, 30% of residents are from black and ethnic minority background, and this is a very, very big issue for us in Putney. I have a group called the Putney Black Lives Matter group, and we meet and we discuss what issues would be important for local people, and this was one of the issues highlighted as of major importance. I also know that we are few here today, Chair, but across the country it's a very big issue for many people. 187,520 people signed the petition to improve maternal mortality rates and healthcare for black women last year, of whom 200 were from Putney. And I would like to start by also thanking the campaign groups that have been raising this so strongly. The 5 Times More campaign, Bliss, SANS, the Birthright campaign, and the Royal College of Obstetricians and Gynecologists for raising these systemic racism and structural barriers which lead to these appalling statistics. And the member for Streatham read out the statistics, but I do think it's worth reiterating them again because this is the heart of what we're talking about today. That black babies have a 50% increase of neonatal death and a 121% increase of stillbirth. That black women have a 43% higher risk of miscarriage. That black women are 4 times more likely to die during pregnancy or up to 6 weeks postpartum. That women of mixed heritage are 3 times more likely to die. Asian women are twice as likely to die. These are horrendous statistics. Each loss of life is a tragedy, but it's a gross injustice as well that we should all care deeply about. It needs to be understood and it needs to change. And it's important to place these awful statistics within the wider picture of health inequalities as well. Black women are facing disparities when it comes to stillbirths, to cancer diagnosis and outcomes, and access to fertility treatment as well. These are entrenched and deep-rooted inequalities, deep-rooted racism and sexism. And so it is going to be hard to change that. It's going to be hard to turn this around. So I understand that the Minister will need to keep coming back again and again and knocking heads together in different departments across government to change this. But it needs to be done. I have got a lovely list of 7 things that I would like to see action on. And I hope that the Minister will be able to respond to them. First of all, we need a whole government approach, recognising inequalities and that the links to wider government policies, which have been mentioned by the Honourable Lady, the Chair of the Select Committee on Inequalities. So we need to have that white paper on health disparities looking across departments, but also a new tobacco control plan for England and public health measures to address obesity and a new air quality target for England as well, all of which have been seen to be factors in the increased black maternal mortality figures. There is an increased risk of poorer maternal and perinatal outcomes, including stillbirth and miscarriage, and inequalities in exposure for black communities in the UK. And that's the link between air quality, air pollution, and maternal health inequalities. There needs to be a commitment to reach the interim World Health Organization targets by 2030 rather than 2040. We could speed this up. And again, what gets counted counts, and what's a target gets strained towards more strongly. There are dangerous levels of air pollution, especially in our urban areas, that need to be addressed. Number 2 is the continuity of carer. And I would like to pay tribute to the South West London CCG, now ICB, and the chief nurse there for what she is doing to tackle black maternal inequalities, and especially in the area identified of continuity of carer. There needs to be the same team throughout pregnancy. And I pay tribute to our wonderful Emerald team who cover us from the St George's Trust as well. Women who receive continuity of carer are 16% less likely to lose their baby. This is a major focus for change in South West London. and local maternity systems across the country are asked to implement equity and action plans, including a target of 75% of women from Black, Asian and mixed ethnic groups receiving continuity of carer by 2024. I would hope that we could increase that, and I know progress is being made towards that target, but to really look at the target to find out that there's enough data to measure that target and ensure that across the country, no matter where you live, that target is being strived towards. So I would like to hear from the Minister what the current status of that target of continuity of carer has. The Government response to the Health and Social Care Committee report on the safety of maternity services in England accepted the recommendation. There was a recommendation on this in that Social Care Committee report, and the Government accepted that recommendation on the training for continuity of carer teams, and that's absolutely essential. There needs to be training across the board and then implementation of continuity of carer teams. But this obviously relies on enough and high enough staffing levels, which relies on high enough funding for the midwife workforce. The third point is that I'd like to see the ending of maternity care charging for migrant women. This deters many women from seeking vital antenatal care, and it is shocking that the Embrace, M-B-R-R-A-C-E, for Hansard, confidential inquiry into maternal deaths identified 3 women who died, which may have been as a reluctance to seek care because of costs. To know that's happening in this day and age in our communities, that there are women who are afraid to go and seek care because of their immigration, asylum seeker, migrant status, is really shocking. My fourth point is further evidence and research and data, which has been highlighted by other members. The differences in outcomes and the reasons for this are unclear and under-researched, but we know that what gets counted counts. I would join with campaigners in calling for an annual maternity survey of Black women, for increased research to identify the conditions that disproportionately affect Black women, to improve the ethnic coding of health records, and to have an improved system for women to submit feedback, for their voices to be heard, and for that to be as easy as possible to be able to undertake whilst they're still in hospital or under maternity care, so that we can hear those voices and that they can feed in to the further data and numbers. My fifth point is about maternity bereavement services. This was highlighted last week in the debate on baby loss, that there is a difference of maternity bereavement services across the country. And if we're looking at these shocking figures, we have to look very sadly at the amount of women who suffer bereavement, and do they have adequate bereavement services? St George's Hospital Trust, of which Queen Mary's Hospital in my constituency is a part, now have 2 bereavement midwives, 2 specialist consultants, 1 part-time psychotherapist in the maternity bereavement team. And there are dedicated places for those who have suffered bereavement in maternity services across the whole of the South West London Integrated Care Board area, which is to be welcomed. But is this happening across the whole country? It's being questioned that it is, and it's very, very important for both that immediate time of loss, but also for the care in future pregnancies as well. My sixth point would be to request, as others have, the white paper on health disparities, which will be so important to tackling this and many other underlying reasons for these statistics. And then my 7th point is to ask for a target. If the Minister is in any of these meetings where other ministers get together and discuss this very important issue, I hope that this will be her number 1 ask, is that the need for a target and then the concentrated effort to focus towards that target, I hope, will lead to the change we need to see. In conclusion, Chair, Black women cannot afford to wait any longer for action. There needs to be a clear action plan, clear data, that transparency and that clear target. I look forward to hearing the Minister's response, but I look forward even more to action, and I thank all the midwives who give extraordinary care and go above and beyond in all of our maternity services throughout the country. Thank you.
Thank you very much, Chair. And I'd like to close by firstly thanking all members for participating in this debate and adding their voices to all of those of us that are calling for steps to be taken to end racial disparities in maternity care. It's always reassuring to hear just how much support there is across the House generally when raising these issues. I'd like to thank the member for Strangford, who's always a huge support in a range of different debates, but been particularly helpful today. And of course the member for Romsey and Southampton, who does fantastic work as the chair of the Women's and Equalities Committee, but also as the chair of the APPG for Muslim women. And just to point out some of the disparities that she has touched on, including from the particular report from the Muslim Women's Network, which showed that Muslim Somali women who may have given birth in other parts of Europe found that actually whilst they face worse discrimination in society in those other parts of Europe, they face much better maternal care in hospitals in those other European countries, namely Norway and Sweden, than they did when they experienced healthcare and better outcomes as well. So that's definitely something for us to look at. And the member for Putney and Roehampton and Southfields pointing out all of those different factors that affect black maternal health outcomes, which all come full circle to point to the institutional racism that black women are facing right across society. The member for Leicester East, thank you very much for raising the issue of the health disparities white paper. We absolutely need to see that soon. Without that, I'm not sure how we're going to set a benchmark for things changing overall. The member for Glasgow North East, I know she isn't here, but she's a huge supporter, and I hope she feels better soon. But the member for Glasgow East was very, very helpful and has been been great in his work with the APPG for premature and sick babies. And I'm very, very pleased to see their work calling on and anti-racism across care. I think that's been particularly important. Yesterday we had a lobby in Parliament, 5 times more lobbied parliamentarians, and so thank you to all of those that signed the pledge calling on the government to use existing data to close the gap and to address overall disparities in maternal outcomes. Tanuke and Chloe from 5 times more continue to punch well above their weight. They are the only black maternal health charity focused specifically on the outcomes for black women, and they're the only charity that I can think of such as that actually receive no funding. They have been able to do all of this work off their own back, and I think that's testament to themselves and their dedication to resolving these disparities. Now, as I said earlier, and of course the member for Bolton South East, how could I forget? Thank you very much, and welcome to your new place as a Minister for Equalities. I was really, really pleased to hear you commit the Labour Party to bringing about that target. I think that's very clear and shows that the party are listening to what black women have asked for right across these past few years when these issues have arisen. So thank you very much for that. Now, with the research that's already been done, we simply want the government to engage with it. I understand definitely, and we're calling for more data to be captured, but we want the government to be engaging with the data that already exists. And it's so key because so much work has gone on with other organisations, including the Muslim Women's Network and Birthright, in producing the reports that we've referenced today, and lobbying and campaigning. So some of these things exist and they need to be acted on in the way that they've produced them already. And they've gone out and spoken to a great deal of women. Sadly, women that didn't want to engage with the particular with the government's own surveys, which is worrying and something that needs to change overall. But I want to pay tribute to all of those women because it's really, really difficult to relive your trauma in that way, to recount all of these awful things that have happened. I know it has been for me, but I want to thank all of those women that did come forward to share their stories and just pay tribute to them because they need to, and I'm sure they do understand that it makes a difference moving forward. And to the Minister, I'd like to thank you for your response today and the quite thorough detail in what's already been done. I think that's really helpful. I'm really, really pleased to hear a change in attitude as to how these issues are addressed. I've been really concerned in the past particularly with the CRED report, and particularly with some of the responses I've received personally, that the Minister is willing to admit and focus on the racial disparities that do exist rather than saying that they don't. And I really do encourage you to specifically, and you said you had, which I think is great, to read all of those reports that I've referenced today. And obviously not just the statistics, but the personal accounts, because they don't make for easy reading, but they definitely make for a greater understanding of what's been happening. But just to touch on one thing, or two things that she said specifically, the socioeconomic status. Now, you're absolutely right in terms of people's socioeconomic status are always right across different health outcomes has a direct effect. But the 5 Times More report, and actually others, and the other 2 reports as well, found that when it comes to black women, regardless of their level of education, regardless of their socioeconomic status, they are still reporting the same disparities. So we do have to look very closely at that and acknowledge that the issue is purely racism, institutional racism, and that is going far beyond all the other factors that we would usually expect to have an impact. I want to leave the Minister with a few more suggestions in terms of things that you might wish to introduce.
She keeps saying you. When you say you mean me. And I'm not involved in any of these things. She might do those things.
My apologies. And I'd like to leave the Minister with a few more suggestions in terms of measures that the Minister's Department might wish to introduce. And the first is, of course, to call again on the government to introduce this target. Now, I understand your reasoning about not having. I understand her reasoning, the Minister's reasoning, for not having a department, for not having a target. And whilst it may appear to be more logical, I just don't understand how we can address women who are told and know from the data they have a 43% increase, their child has a 43% increased chance of being miscarried and a 121% increased chance of being stillborn, and say that we're going to look at all of these measures surrounding it, but we're not going to specifically set a target to bring it to an end. It's not acceptable, and I do not believe those women that continue to campaign for this target are going to accept this. So I really do ask her to look at that again. And I understand that there are great challenges with looking at disparities across the board, and absolutely all of those things need to be addressed, and different departments need to be brought in. But as I pointed out with the issue of the socioeconomic status and all of the different factors, it points to a culture and an issue with institutional racism within our NHS, and that needs to be resolved overall. And obviously that's going to start with data, the NHS improving the quality of ethnic coding and ensuring that it's accurately recorded. I'm really, really concerned that how skewed it is in terms of recording. We actually heard yesterday at our APPG meeting that even when it comes to simple things like accessing trying to find out how many women have claimed compensation, for example, for issues that have happened. They may record the age of the women, they may record the area which the women have come from, but they're not recording the race of women. And that seems like a major oversight for me, especially when other pieces of data are being gathered. Now, I want to also support 5 Times More's call for the government to introduce an annual maternity survey targeted specifically at black women, similar to the CQC maternity survey, and because I believe the results of this could be used to inform both public and parliamentary accountability in improving maternity health services. And we do know that whilst it seems that a very low number of women contributed to the government's survey, there is a willingness of black, Asian and minority ethnic women to record their issues and their experiences, as the other campaigns have proved. And finally, in terms of calls to the Minister, I'd reiterate that call for an inquiry into institutional racism within the NHS. That's the only way we're going to change some of these outcomes, especially with all of the information that has been gathered on what the specific issues are. Yes, we have to look at air quality. Yes, we have to look at other comorbidities. But until we address racial bias and assumptions amongst medical staff, teaching and training, there are certain things that are just not going to change. And finally, again, another finally, just please engage with the campaigners. I understand that there's a lot of listening going on, and definitely in the past few years we've heard more and more, and there have been more conversations, and they're more likely to be included in working groups. But it's one thing to take on board, and one thing to say, yes, we do have to look at this, and one thing to say it's really awful, but another thing entirely to engage with them specifically, work with them across different areas, and actually show that the things that they are asking for are being met within the NHS's plan. So please do engage with these campaigners. They know what they're talking about. They have the data that the government has not been able to collect from women. They understand what the issues are, and they are certainly making the right calls. What we need to be doing to bring this horrible disparity and close this racial divide, and make sure that black women, Asian women, women of mixed heritage have safe births. Thank you.